Okay, so for today's first lesson, I will be doing cavitation, demonstrating cavitation on my model. So first things first is make sure that you are washing your hands. Make sure that you're sanitizing thoroughly as well due to COVID. Also, you need to make sure that you are wearing gloves. And each time you switch out doing a session, you need to wear a pair of gloves, okay? So I'm going to go ahead and get started on the demonstration of getting cavitation done. And I will be explaining thoroughly what cavitation means, what it does, and the benefits of cavitation. So first thing is you make sure that you take a pad, place it on top of their abdomen of their stomach. You do not want to get their clothes messed up, so you put the pad on the abdomen of the stomach. Okay, you turn your machine on. First thing is you go to the cavitation. You set it all the way up. Now cavitation usually takes anywhere from 3 to 5 minutes. And that is really for each probe. It takes anywhere from 3 to 5 minutes. You can go 10 minutes or longer. That depends on the client and that depends on the section on their body. So I'm setting the machine to 3 minutes. First things first, I will be using what you call ultrasonic gel. The ultrasonic gel helps to pretty much find the toxins, which that is what cavitation is finding the toxins, and you're disposing of it through the urine area. So first things first, I take some of my ultrasonic gel and I'm placing it on the stomach. So this first probe right here, this is what you call a cavitation probe. This is the probe that finds all the toxins and you help dispose of it through the urine area. So with this probe, your clients will hear a noise in their ear. It is not unbearable, but they will hear a noise in their ear. So you take this probe and you go into a circular motion. Now with the cavitation probe, you have to make sure that it does not touch the vital organs of the body. So that means it does not touch the breastbone, it doesn't touch the vertebrae, and neither the pelvic area. So you go in a clockwise shape because that's the way the urinary system is. And then after, you go in a V shape. So you're taking your probe and you're going slanted on top of the pelvic area. At this time, you're bringing all the toxins down to the abdomen area so the client can dispose of it through the urine. So you do this for about 3 to 5 minutes on the client just to make sure that you're getting all the toxins. What it's doing is it's pulling from the stomach and all the toxins are being pulled up. Basically like it's a magnetic. And you make sure you're doing it on each side. Okay. Make sure you stop your machine right after you are finished. So this first probe again is called cavitation. This is called a flathead. So this is the first probe that you would use. Now this probe you do not use on the back. Only use this probe on the stomach area. So you would wipe. This is what you need the pad for, is to wipe right after. All right. Step number 2.